Hey, it's Dr. Rupeka from Youthology. I'm going to do a face contouring appointment with my good friend Kristen Jacobs. Kristen's an injector in Cleveland, so if you live in Cleveland and your EV battery in your car can't get you out to my office, you can go to her as plan B, and I think that that'd be a great option. Just joking, but Kristen's postpartum and she just reached her pre-baby weight. So we're going to infuse her today with a collagen biostimulatory filler or product called Sculptra. Sculptra's poly-L-lactic acid. Why do you think Sculptra is a good option for you?
I like it for the collagen building and it lasts a really long time.
Right. And what's great about Sculptra, and I'll show you, it's a powder. So when we inject it in a patient, that powder kind of works behind the scenes to make their skin healthier. Healthier skin looks younger, it glows, it plumps, it lifts. So it's a great way to add volume without making patients puffy.
It looks really natural.
Yeah, perfect. Hey, so this is Sculptra. We're going to use Sculptra on her. Sculptra is a powder. It's a collagen biostimulator. So this version of collagen biostimulator comes in a powder form like this. We have to reconstitute it, which means we add sterile saline. I put a little bit of lidocaine in here. When we add this to it and put this in here, we'll let this settle, but the powder gets suspended in the water, and then we're going to inject this patient with water, basically with the infused powder in it. So when people ask, well, how much volume will I get with something like Sculptra? Well, the answer is you'll get a little bit of volume today because we're going to add the water. The water is going to get injected into you, but then your body will absorb that water over the next, say, 1 to 2 days. And then this powder is just mixed into your skin. The powder forms collagen. Collagen makes your skin tighter. Tighter skin looks healthier, looks more youthful, looks younger. So I reconstituted the Sculptra now, and this is what it looks like before it gets injected. So this is the water that's infused with a collagen biostimulatory powder called poly-L-lactic acid, or PLLA. When I pull it out of these vials, we leave the preservative that comes with it in here because this is what clogs the syringe. So if you're an injector and you're watching this, you want to try to leave as much of this white frothy stuff in the vial as you can, and your vials that are loaded in your syringes should look like this, just a little bit cloudy. So I'm cleansing her face here with hypochlorous acid. It's a cleanser. You can use obviously alcohol, but we're just trying to get the makeup off and prep the skin. I'm an injector that still likes to mark patients, so I just sort of make myself some little guidelines. And I feel for markers under the skin. Turn your head to the right a little bit. And this just helps me make sure that I'm keeping all of my injections where I want them. Okay, turn your head to the other side. Kristen's a great patient for injectable work because she's in really good shape. She's thin, and thin patients just need volume. So you can put volume back in your face by gaining weight. Who wants to do that? Or you can put volume in your face by, somebody putting volume where it's beneficial. So she's an easy patient. If you can lose weight, if you're, trying, but keep your weight in your face and your breast and your butt, that's like perfect, but nobody can do that. So I like to inject patients with a micro cannula. Micro cannulas are like a long needle without a tip on them. So I made a little puncture hole in her skin with a needle because the cannula can't break through the skin. So the cannula gets fed through the little hole. And then what I'm going to do is I'm going to use the Sculptra that's infused in this water to hydrodissect, or use the water that's in here to push apart the tissue so the cannula goes through a little bit easier. And we're going to do this very delicately. And like I was telling you earlier when we were mixing this, we infuse it with a little bit of lidocaine. So it should be pretty painless. Is it pretty painless, Kristen?
Yes.
So when you do injections like this, we don't use any topical numbing cream on the skin because you don't have to. We're working under the skin. And I put a little marker on her temporal fissure up there. That's where the two parts of her skull join and they form that little line. I like to keep my temple injecting on the lateral side of that line.
Wait, why do you use a micro cannula? Should I start doing that?
Well, the micro cannula, it's safer because it allows us to inject products without worrying about putting the products inside a vessel. So the micro cannula doesn't have a tip on it like a needle would. And so it doesn't, poke through veins, poke through an artery, poke through a place that we don't want it to. So it allows us to push under the skin and place our products a lot more safely. The way that I tell patients, the way that I tell injectors to inject with a micro cannula is you shouldn't have to force it under the skin. If you're forcing it, then you need to pull out and redirect a little bit because you never want to force anything in here. That's how you get bruising. That's how you get bleeding. So I'm just working that Sculptra into her temple. What's great about Sculptra is, again, because it's mixed in water, it just works into the tissue really easily. And like I was telling you earlier, this is swelling from the cannula use and swelling from the water, but when this water gets absorbed, it'll just be a powder under the skin and it'll look like she didn't really have anything injected until the Sculptra starts building collagen. So we're making another little cannula port this way. So again, if you're an injector watching this, I always like to kind of aspirate my cannula a little bit just to make sure that there's no Sculptra in the cannula that's going to clog. And we're going to go in through our cannula port that we made with a little needle. And I'm going to hit our anterior midface. So we have a zygomaticus cutaneous ligament that goes in here, down here, and our orbital retaining ligament that goes up here. We're going to go right between those two ligaments and just fill the volume in our midface. Incidentally, I'm one of the advanced Sculptra trainers in the country. So if you are interested in doing any Sculptra training, you're more than welcome to come and train on this with me.
I don't know. I'd love to. You're talking to me, right?
Well, I'm talking to anybody, yeah.
Or on the video? Oh.
So again, this should just slide through the skin. We're not fighting anything. If we hit resistance like here, we're just redirecting. So now my cannula tips all the way back into her hairline. I like going back pretty far because we're trying to pull backwards, right? Everybody wants this. So that's what we're trying to do with the collagen. We're injecting the collagen back in here. So as it tightens the skin in her temple and her scalp, it's going to pull back her cheek. And again, because we're just injecting water, we're not looking for immediate fixes here. Sculptra builds collagen. It takes our bodies about 6 weeks to start to form a collagen fiber. Then for those collagen fibers to start interconnecting and form a network that actually lifts the skin, it takes about 3 to 4 months. So what we're doing today is we're laying a foundation and prepping our skin for it to be tighter in about 3 to 4 months. So this isn't a product where, hey, I have a wedding this weekend, I want to go get injected and everything will look better by this weekend. This is more of a, I'm aging, I don't want to look my age. Let me do this a couple of times a year and I'll stay ahead of the game. If you do have a wedding this weekend and you're trying to look better, then that's when you need like a Silfirm treatment, or you just go and get a dermal infusion or get a facial. So I put a little bit of Sculptra, just a little bit in her cheek there, because you can see where she's starting to get a little wrinkly down in here. So we're trying to pull again backwards. What's great about Sculptra in this area is it's not going to make her face wider, it's going to pull back. So when I was injecting, I don't know if you can see it under the skin, I was injecting like this. This is called a fanning pattern. So we're fanning back towards here. Then you can see I did that whole side of the face through 3 little injection points. All right, so we're making an injection point here.
Hold on.
So we're using a micro cannula to inject the Sculptra on this side of her face. Again, the Sculptra's infused in this water. It looks great because we didn't aspirate that white frothy stuff, that oxycarboxycellulose. I made an injection point with my needle because the cannula doesn't have a tip on it, so it can't break through the skin. We use a cannula because it's safer. We can't get products into a blood vessel. We usually can't break through things we're not trying to break through because there's no sharp tip on the end. So what we're going to do is we're going to slowly ease this through the tissue. Obviously, you see the veins in her temple. We're not trying to break those open. That would cause a bruise. That would cause bleeding. So I'm working my cannula under that. So see my cannula tips against her temporal fissure here? I'm going to use the water as my friend and use the water to make space in here. So this is called hydrodissection. So I'm hydrodissecting this tissue with the water. The water has that Sculptra infused in it. As Kristen's body absorbs the water, the powder will just lay in here and then it'll eventually tighten her skin. Tighter skin is usually looks better because of that collagen infusion. Her skin texture will get better. Her skin tone will get better. This is a great treatment for large pores, fine lines, wrinkles. Obviously, like anytime we can do things to add collagen to our skin, we want to do that. So look, like no bleeding. I'm going to cover my little hole and I'm going to massage this into her temple. What's great about that water is water works into the tissue very easily, so it's going to spread. This is different than when I inject somebody with, say, Belafil. Belafil's mixed in gel. It's the same theory. We're still injecting a collagen stimulator, but the gel stays put. If you're an injector that injects Radiesse, that's sort of similar to Belafil in the sense that it'll stay put because it's gel infused, not water infused. Sculptra diffuses in tissue, so I use Sculptra to treat the whole area. So this is more, to me, a foundational product. We're laying a foundation. So I made another little port here. I'm going to just ease this cannula through. Like I was telling you before, we shouldn't be forcing anything. Again, I'm going to go all the way back into her hairline because we're trying to pull backwards. So I'm just layering this product in the area that I want to pull towards. Feel like didn't hurt, right?
No, it was good.
Yeah, you might just feel a little pooling in places. Like I said, there's numbing medicine in all of these injectables. We don't have to numb the skin topically because I just do everything through these 3 little holes. So you get 3 little pokes.
Yeah, it was easy.
Yeah, it's easy. So again, we're not trying to like show a great before and after initially because I just infused her face with 20 cc's of water. This is 10 cc's, so 2 of these. We put 1 on each side. But I treated her anterior midface, her temples, her lateral cheeks, and then her lateral cheeks down here. Because we're trying to pull backwards. Okay, so now, you know, because like we were talking earlier, because Kristen's a little bit more volume depleted, I'm gonna put just a little bit of regular HA filler. In this case, I'm gonna use Restylane Contour. I put a little longer cannula on here, and I'm gonna just feather some filler in here to just give her this little bit of volume so this part of her cheek doesn't look as gone. This is one of the reasons where I'm not a big fan of when people get buccal fat removed, because it'll automatically make this area look too thin. And sometimes when your cheek looks a little bit more hollow, you can see more of a patient's bone structure. When you can see more of a patient's bone structure, our brain perceives them as looking a little older. So we're using Restylane Contour again here. Restylane Contour is just a hyaluronic acid filler. So I'm just feathering it in her cheek. There, that looks really nice. But I'm still gonna try to not force anything. I'm gonna slide right through. I'm in that part of her lower cheek, and we're just gonna feather a little bit of this product to fill in some of this space. Again, this should be really comfortable, right, Kristen?
Mm-hmm.
So see a little bit of resistance here. You just have to keep working it if you're an injector until you find that spot where it just glides right through. That's it. Looks great. So again, I just filled this in a little bit with a regular hyaluronic acid filler, which will plump up over the next 2 weeks. The Sculptra, again, will take about 3 to 4 months. So what our plan is to see each other again after all the holidays, and then we'll just add a little bit more Sculptra.
You're good.
All right, so we finished injecting Kristen. Obviously you saw I used 2 vials of Sculptra and 1 syringe of Restylane Contour. What'd you think? Not too bad, right?
No, it was easy. I was
We
like
made-
sleeping.
We made 4 holes on each side of her face with a little 25 gauge needle. So this is immediately after, even with 20 cc's of water infused in her face. So if you want to think of it per syringe, it's almost like I did 20 syringes of filler on her. She looks a little puffy, but really not bad. Like, you can go to work like this. Maybe you don't want to do this the day before an event, obviously, like we were talking about earlier, but you know, as far as like putting that much volume in somebody, when you put it in like we did and you feathered it around, you can really like make patients not look like they got injected today. This whole swelling is going to go down in about 2 days. Like I said, her body's going to absorb that water, and then she's going to have mostly that polyl-lactic acid powder in there. We did put a little bit of regular filler in her cheeks, but again, it looks very natural. So if you're interested in anything like this, you can obviously see Kristen. If you're around the Cleveland area, you can obviously see me if you're around my area, but we'd be happy to talk to you more. You can DM us, ask us any questions about this, reach out to us, find us on our social media. Hope you enjoyed. Thanks for watching.
Thank you.